Hello guys, I Dr. Virendra Kumar Gupta welcomes you for your YouTube channel. Today we will discuss about the birth defect. This is neural tube defect. Birth defects most common are heart defects, cleft lip or calf palate, Down syndromes, and today we will discuss about the neural tube defects. Before to know about the defect, we should think what is the neural tube. So neural tube is embryonic precursor to the central nervous system, which is made up of the brain and spinal cord. So formation of neural tube is started and human nervous system originate from the primitive ectoderm that also developed into the epidermis. You can see here guys in this slide, and by the third week of the development, the edge of the neural plate start to thicken and lift upward with the forming of the neural folds and neural crest. Finally, the center of the neural plate remain grounded and allow the U-shape neural groove, and ultimately the neural fold pinch towards to the midline of the embryo and fuse together to form the neural tube. You can see here there is the neural tube which is divided with the ectoderm, and the neural tube is the open both end at the cranially and caudally. This is known as rostral neuropores and caudal neuropore. These opening called neuropores. So these are rostral neuropore and caudal neuropore. These opening are closed during the 4th week of gestational age, and if there is improper closure of the neuropores, that can result in the neural tube defect. So embryologically, there are two processes which form the central nervous system, which called as neurulation. In the first neurulation, there is the formation of the structure into the tube, thereby forming the brain and spinal cord. And in second neurulation, there is the formation of the lowermost part of the spinal cord, which is lumbar and sacral elements. And developmentally, initially the neural plate form at the 17 days of the embryonic life, and neural fold form with the neural crest and neural groove is formed on the 21 day of embryonic life, and finally the fusion of the neural fold done after the 3rd week of life and neural tube is formed. If there is any disruption in these all 3 A's, there is neural tube defect is known as cranioacacia, which is very severe and dangerous neural tube defect. There is no life, and after all the neural tube fusion from rostral and caudal bilaterally, primarily is the rostral side and later on in the caudal side. By the 23rd to 26th days, there is closure of the rostral neuropore. If there is any failure, you can see there is the development of the brain is hamper. This is known as Anencephaly. There is rudimentary brain, you can see here. And by the 26 to 30 days of the closure of the caudal neuropore, this is, if there is any failure of this caudal neuropore, meningomyelocele or meningocele is shown. So finally, definition of the neural tube is the account for the largest proportion of the congenital anomalies of the central nervous system, which is 1 to 3 per 1000 live birth, which is result from the failure of neural tube to close spontaneously between the 3rd and 4th week of the gestation. And dysraphism is a group of disorder which result from the failure of closure of embryonic posterior and anterior neuropores, which is associated with the abnormal development of the other part of the neural tube and bony and soft tissue structures. And etiologically, there is some teratogens which are hypothermia, sulfur drugs, antihistaminics, anticonvulsants are important causes of neural tube defect. And most strongly there is carbamazepine and valproic acid, which is folate antagonistic, having the risk of 2% neural tube defect. And folate deficiency, low red cell folate levels, malnutrition, having the low dietary folic acid, chemicals and radiations, and maternal obesity and diabetes also causes neural tube defect. And there is genetic determinants and multiple causes which cause mutation in the folate responsive or folate dependent enzyme pathways. If there is any family history of the neural tube defect, if there is certain syndrome or chromosomal disorder associated with the neural tube defect, or if there is low dietary folic acid is also responsible for the neural tube defect. What are the types of neural tube defect? There may be cranial neural tube defect due to the defect in fusion of the rostral neuropore, or if there is spinal neural tube defect which is due to the defect in the caudal neuropore or posterior neuropore. Cranial neural tube defect having further divided into the anencephaly or encephalocele or congenital dermal sinuses. You can see in this picture there is the anencephaly with the defect in the brain, and encephalocele is further divided into the myelocele, where you can see there is herniation of the brain tissue through the cavity. And there is meningomyelocele or myelomeningocele, there is herniation of the brain tissue along with the sac which is opened at the posterior side, and congenital dermal sinuses. And spinal neural tube defect is divided into the three parts, that is spina bifida occulta or aperta, or cystica or congenital dermal sinuses. Cystica is further divided into the myelocele. In the myelocele you can see there is only membrane is herniate through the defect in the vertebral body, while in the spina bifida occulta there is only defect in the vertebra. There is no herniation of the membrane or spinal cord. In the meningomyelocele or myelomeningocele, there is herniation of the spinal cord or neural spinal nerves with the membrane through the vertebra. The neural tube defect or spinal dysraphy is classified on the basis of open or closed. There is open neural tube defect are myelocele or myelomeningocele, and in close there is associated with the subcutaneous fat are lipomas with a dural defect, meningoceles and terminal myeloceles. Without subcutaneous fat there may be complex dystrophic effect or simple dystrophic effect. In complex there is disorder of the notochord formation which are caudal agenesis, segmental spinal dysgenesis. If there is disorder of the midline notochord integration, there is dorsal enteric fistula and neuroenteric cysta and dystematomelia. And simple dystrophic effect are intradural lipoma, flare lipoma, tight phylum terminal, dermal sinuses, persistent terminal ventricles. So we will discuss here one by one. Anencephalic. The anencephaly is result from the failure of closure of the rostral neuropore, having the large defect of the calvarium, meninges and scalp, which is associated with the rudimentary brain, and there is only residue of the brainstem can be identified, and there may be found some additional anomalies like calf cleft, calf palate or renal anomalies, and the children is die or infant is die within the several days or hour after the birth. And encephalocele is the part of brain or meninges herniated through the congenital or traumatic or post-surgical defect. You can see in this picture, guys, there is the cranial encephalocele where the CSF is leaked out from the sac, and it contains the cerebral cortex, cerebellum or portion of the brainstem. The most of it is occipital, which is more common than frontal and nasal encephalocele. It having the risk of hydrocephalus, which is due to the aqueductal stenosis, Arnold-Chiari malformation, Dandy-Walker syndrome, visual problems, microcephaly, mental retardation and seizure problems are there. Now come to the spina bifida, which is the most common congenital central nervous system defect having during the development of the prior to the birth, when the spinal cord, brain or meninges having protective covering which does not completely develop. If there is development of these covering is not developed, there is the spinal cord, brain or meninges are herniated, and it can be anywhere along with the spine, or usually can be seen in the opening of the baby's back at birth, or a sac of fluid that has grown outside the body on the spine. The sac may or may not include the spinal cord inside. The spina bifida types are, there is spina bifida occulta or spina bifida cystica. In the spina bifida occulta, you can see in this first picture, there is only defect in the vertebra and there is no defect in the, no herniation of the membrane or spinal cord is intact. In cystica, there is two types, there is meningocele and myelomeningocele, where in the meningocele there is herniation of the meninges through the defective vertebra, and the myelomeningocele there is herniation of the spinal cord or neurons along with the membrane through the defect in the vertebra, and it may be open through the spina bifida. And spina bifida occulta is the gap between the vertebra and there is no visible opening outside, and there is no fluid sac outside the body, and there is some small birthmark maybe there may be some dimple at the back. You can see in this picture there is the dimple, or there may be some group of hairs or cluster of hair or tuft of hair at the back, and an area of fat may be found at the back, and due to this there may be difficulty in diagnosis of the spina bifida occulta and may found later on the life, and it may be without symptoms. And meningocele is the small opening at the back where the sac that visible at the birth. Here the sac is visible and membrane pushing out through the opening in the vertebra into the sac, but there is no herniation of the spinal cord or nerves through this sac, only membrane is found in this sac, and normal development of the spinal cord is there. You can see in this picture. And meningomyelocele or myelomeningocele is the open spinal canal over some vertebra, most commonly L5 and S1. You can see in this picture there is spinal cord is pushed along with the membrane outside in the exposed, or skin is maybe covered the sac. In this type of the spina bifida, there is weak or paralyzed leg muscle may be found, there may be seizure, there is some deformed feet like club foot, hips there may be even or not even, and scoliosis or curved spine may be found, and due to the neurological bladder there may be bowel and bladder dysfunction in this type of the spina bifida. The sign and symptoms of the neural tube defect are, there is some radiological sign may found, there is a laminar defect, there may be some hemivertebra, scoliosis or widening of the intervertebral distance, and butterfly vertebra may be found. There some cutaneous stigmata may be found, which are capillary hemangioma may seen, there may be some caudal appendages, dermal sinuses may be found, or there may be tuft of hair or hypertrichosis may be found. Some orthopedic finding may found as the extremely asymmetrical of the vertebra. There may be some foot deformities like club foots, or there may be some neurological problems like weakness of the legs or radiculopathy may be there, or there may be some leg atrophy or asymmetry. There may be loss of sensation or abnormal gait, or urological problems may be found like neurological bladder and incontinence of the urine, and associated with maybe anal wing. Guys, we can diagnose the spinal defect or neural tube defect at the prenatal screening through the ultrasound examination, usually at after the 18th week of pregnancy, and anencephaly could be detected earlier than the 16th week. And due to the opening of the neural tube defect, the alpha proteins is leakage in the serum of the mother, so maternal serum alpha protein level is high in case of neural tube defect, and as well as amniotic fluid alpha fetoprotein levels is also high during the neural tube defect. And there is amniotic fluid acetylcholinesterase level may be low, that indicates some form of the fetal abnormalities. And investigation can be done, as MRI is the best imaging neural tissue and identifying content of the defect. CT scan may be done for the direct visualization of the bony defect, or there is anatomical defect. Ultrasound may also be done for the prenatal screening or useful for the early diagnosis of the hydrocephalus or brainstem lesions. X-rays also beneficial. So guys, if parents are not concerned with the abortion with the neural tube defect children, there may be some counseling is required, because the outcome is dependent on the lot of level of the defect. If there is level is lower lesion, there may be result of the relatively mild defect, while the higher level of defect or cervical defect, there is deficit is higher. Another issue is there is related with the hydrocephalus. There may be some cerebellar malformation or long-term congenital dysfunction. If there is diagnosed early, there enough fetal surgery is promising. These are hope of hand, and now these decrease the rate of hydrocephalus and other congenital anomalies. There are two major sequelae found in the neural tube defect, which are hydrocephalus, which is shunt dependent, and congenital malformation, which is Arnold-Chiari malformation, second type of malformation. And initially we should examine the patient and what should be treatment to be given. A neonate born with the neural tube defect, we should focus on the neurological sequelae at the site and level of the lesion. What is the site and what is the level of lesion? Is there any motor or sensory defect? If there is presence of the hydrocephalus or any Arnold-Chiari malformation, or there are orthopedic deformity may be found up to 20% of the patient, in these cases hip dislocation, scoliosis, kyphosis, etc. The patient to be sit in the prone position and covered with the saline sponge to be prevent for the drying of the neural play cord, and patient to be kept without and nothing per oral, and IV fluid to be started along with the antibiotics due to prevention of the meningitis due to the leaking lesion of the ventricles. And ultrasound of the head for the early detection of the hydrocephalus and brain disorders. MRI for the congenital malformation or Arnold-Chiari malformation and migrational problems. The neural tube defect should be repaired within the 72 hours after the birth. When the repair is done, 95% needed ventriculoperitoneal shunting. Any signs of the Arnold-Chiari malformation? There are stridor. If there is any apnea, dysphagia or quadriparesis, there is urgent requirement of the posterior fossa disc compression. And a hope of hand is now in our hand. These are fetal surgeries or fetal surgeries can be done during the intrauterine life, which lower the incidence of the hydrocephalus up to 91% and a lower incidence of the hindbrain herniation up to the 95%. So guys, there are some complications found due to the neural tube defect, which are infection due to the leaking of CSF, and there may be some associated motor or sensory problem, particularly in the lower limb due to the involvement of the spinal cord. If there is associated learning disability or developmental delay or hearing impairment may be found, and there is some bladder and bowel dysfunction may be found. So these are the complications of the neural tube defect. So guys, these are all about the neural tube defect along with the spina bifida, which is very important congenital C.N.S. disorder. And so guys, how was the class? If you like this, press the like button. If you did not subscribe yet our channel, subscribe and press the bell icons to get the earliest notification of the classes. Thank you very much.